Hi everybody, we're into some new content. I really like this particular topic, health of the individual, family, and the community. I feel like it's very holistic in nature, and it kind of touches on a lot of the different theories that we use as nurses to provide holistic care to our patients and their families and our communities. So, meeting basic human needs. We're all about that as nurses, right? And we need to do that so that we can level the playing field in medicine and provide people from all backgrounds and all walks of life with equal health care. So that's enough about that. You can read the slides. I'm not going to read them to you. Now, Maslow's we've talked about. I know we've spent some time on it. We will spend more time on it because it is absolutely imperative that you understand Maslow's so that you can understand how to prioritize, not just on your questions on your exams, but every day in life and as a nurse. So here's some different basic characteristics to understand about how to apply Maslow's, or some just underlying need to knows, I guess. So if a patient or a person lacks fulfillment in any one of the given areas on Maslow's hierarchy of needs, it can result in illness. Opposite, it can also prevent illness, or it can signify that they are healthy. And if we can meet a patient's basic needs, we can restore their health. Basic needs takes priority over the satisfactions that are unmet, which you'll see when we flip to the next slide. And people may feel like something is missing in their life when they have an unmet need, versus they're satisfied when that need is met. So here's your next slide. Your lower level needs are considered the most important, so your physiologic needs come first. And physiologic needs are oxygen, water, food, illumination, temperature, sexuality, physical activity, and rest. Those have to be met at least minimally to maintain life. So the next level is, well, I'm going to give you an example. We always go ABCs and then Maslow's. So your ABCs are airway, breathing, circulation. So for example, if you do not have oxygen, let's say that someone needs cardiopulmonary resuscitation. That would be acute. Their heart has stopped beating, so obviously oxygen is not being perfused to anywhere in the body. So that would be an acute situation where we need to provide oxygen. But we also, as nurses, need to treat people that have chronic illnesses that require them to have assistance and education regarding perhaps special positioning, treatments, and just in general, maybe they need to wear supplemental oxygen. So we evaluate patients' oxygen needs by looking at, we've talked about it in class, skin color, vital signs, anxiety levels, and responses to activity, restlessness, and their mental responsiveness. If you all of a sudden notice that your patient is maybe just pale, but they seem confused or it's taking them longer to answer you, check and see what their oxygen saturation is looking like. Maybe they're confused because they aren't getting enough oxygen to the brain. So we know these things, and we will know them more as time goes on. But those are examples of physiologic acute and chronic needs. Let's see. Food and elimination help us to maintain our nutrient and electrolyte balance and a healthy weight. So we eliminate waste products through our skin, lungs, kidneys, and intestines. And the way that we assess our patient's nutritional status would include their body weight, their muscle mass, their strength, and assessing their laboratory values. Sexuality is an integral component of people's life and happiness. So as nurses, we need to be aware and sensitive to the fact that our patients who are afflicted with physical or emotional illnesses may not be sexually satisfied or be able to satisfy their basic needs, in which case that's a conversation we should have as part of a holistic caring conversation. What about physical activity? That's in there as a physiological need. So our ability to do physical activity depends on having intact and functioning neuromuscular and skeletal systems. So we need rest and sleep to allow our body to rejuvenate and to be free of stress. And those needs for sleep vary widely, but if we have sleep deprivation, we absolutely know that we are not going to function well, which is why we always encourage you to stop studying the night before your test, get a good night's sleep, and then eat a healthy breakfast. That helps your body function and your brain and your mind to make good decisions on your exams. So some different factors that can influence your sleep include age, your environment, exercise, stress, and drug use. Next on the Maslow's hierarchy of needs is the safety and security. So safety and security sometimes can go hand in hand with physiological. Let's talk about what does safety and security entail. They have, again, physical and emotional components. And it means being protected from potential or actual harm. And we do a lot of things ourselves that can be harmful or, on the alternative side, be helpful, and hopefully we're helpful, to meet our patients' safety needs. So I'm going to give you a list of things that I would know that help our patients maintain a safe environment when they're in our care. We use proper hand hygiene and sterile techniques to prevent infection. We use electrical equipment properly. We administer medications knowledgeably, which we are going to get way more into this week as well. We skillfully move and ambulate our patients, so we know how to do that, and we do it very carefully. We teach patients about household chemicals that are dangerous to children, or even pets, or adults. So those are just some examples of your safety and security needs. Next on the list, we move to love and belonging. And as we move up the hierarchy, we've met the physiologic and the safety and security needs. We're feeling pretty good. So now we're getting into those higher level needs. So how can I help someone feel love and belonging? It's a basic need. It includes understanding and acceptance of others in both giving and receiving love, and the feeling of belonging to groups. Those groups can be family, peers, friends, neighbors. It could be a whole community. People that don't feel love or don't feel a sense of belonging feel that their needs are unmet, and they're often lonely and isolated. On the other side of that, they may be overly demanding and critical. So if you see someone who, let's just picture a patient we might take care of, maybe someone in our long-term care facility, and they now live in the long-term care facility because maybe their husband was their primary caregiver and they passed away recently. So now they live in long-term care and they haven't had people coming to visit them. So they are being demanding and critical of the care they're receiving. They push their call light a lot. They're tearful. Their behavior, it just makes sense that their behavior, which is pushing people away, what they need the most is for people to be with them and to hear them. So keep that in mind when you're at your clinical setting and maybe you have somebody who the staff feels is very quote-unquote needy. They truly are needy. They need someone to come in and make them feel like they belong and include them again. So make sure you're assessing for that when you're taking care of your patients. Then next on the list is self-esteem. And self-esteem is where you feel pride and a sense of accomplishment, and others also respect and appreciate your accomplishments. So when you guys walk across the stage at pinning, you're going to have a pretty good sense of self-esteem. And keep in mind that all of these levels go up and down depending on the moment, the day. You could be at two different places according to whatever topic you're looking at. So let's say your self-esteem, you walk across the stage at pinning and your family's there and they're clapping and they're proud of you and they're taking pictures and they're having a party in your honor. And then you take the NCLEX and you pass it. It's awesome. And then you get your first job and you realize, oh my goodness, there's so many things I have to learn. So you might go back a little bit lower and feel like I don't have high self-esteem right now. I got through school, but I am just now learning baby steps how to do this job. I'm a novice nurse. And that's life. That's how we all are. So just like when I became an instructor, I was new to teaching nursing school in the classroom. So it's just a different role, and it takes a while to adjust and become good at it. So you have to be humble and keep yourself open to people's feedback and ideas to improve. But also know that there's a reason why you got that job, and there's a reason why you are where you are, and have positive self-talk. And now the last is self-actualization. Oh, actually, let's go back to self-esteem. I wanted to point out that a lot of different health factors can affect people's self-esteem. So we already talked about role changes like the death of a spouse or the illness of a spouse. It can also be affected by an injury, a growth spurt during puberty, although that's not really our age group, but it totally can. Also, like having lost a body part like a breast to breast cancer can affect someone's self-esteem. So as nurses and a member of the health team, it's our job to help patients' self-esteem needs by respecting their values and beliefs and encouraging patients to set attainable goals and facilitating support from the family, their friends, or significant others. Can you tell I'm reading that straight out of the book? But it's good to know. Self-actualization needs is the top of the pyramid. Do you think everybody gets there? I'm going to go with probably not, and if they get there, they don't stay there. But self-actualization is where people reach their full potential through development of their unique capabilities. So these are some qualities that someone would exemplify if they meant that achievement. So they have acceptance of themselves and others as they are, focus of interest on problems outside of oneself, the ability to be objective, feelings of happiness and affection for others, respect for all people, the ability to discriminate between good and evil, and creativity is a guideline for solving problems and pursuing interests. So the way that we can help our patients meet that level of achievement, we can focus on people's strengths and possibilities rather than on their problems. So there's an example in your text that talks about a patient who is looking at the negatives. For example, I think it was they have diabetes and they're focusing on trying to delay losing a limb because they're not controlling their blood glucose levels. So rather than focusing on not losing the limb, the nurse can refocus the patient to not look at the negatives that could happen, but rather focus on how they can control what's in their control today to help them be as healthy as they can. So rather than think it's an inevitable outcome, because it isn't, help people to see that they do have some control over how their chronic diseases progress, so that we give them hope, basically. Oh, look, I just went through all of this without going through the slides, so guess what? We're probably almost done. We're at family now, so let me find my information on family. This is just some different examples of definitions of family. Do you need to memorize these? No, you just need to kind of recognize what that means, and most of us already know. So a family, just the most important part is anything that you want it to be, and it's defined however your person defines it. But typically, it's people who live together and depend on one another for physical, emotional, and financial support. So that is our book's definition. The nuclear family is your traditional family. You got two parents and their children. And that could be any type of family. You could have two females or two males or however you self-identify. It's just a traditional family where you have two parents and the children. An extended family is all of the, what it sounds like, your grandmas and grandpas and cousins and aunts and uncles. Blended is where you have two parents that have children from previous relationships, and now you're melding them into one family. A single parent family, I don't know if y'all know, but the U.S. is the highest, or the country with the highest number of single parent families. And that can bring its own challenges, as I know some of you are single parents. I was too for a brief few years early on in motherhood. And it definitely is challenging in financial ways and in managing childcare and work and just being all the things to one little person, or maybe more than one. So hats off to all of you that are trying to go through nursing school, work, and be a single parent at the same time. And then we have cohabitating adults, which is just any adults that choose to live together in whatever way they are living together, but they consider themselves family. Sometimes families can just be a single person living with their pet, and their pet is their family. So here's the functions of a family. I would probably know those as well. So physically, let me look at my book real quick. Families are, healthy families anyway, meet basic human needs and maintain the family member's health. And they provide the individual with an environment for development and social interactions. So these are the 5 major areas of family functions. Economically, the family should provide financial aid to family members and also helps to meet society's needs. Reproductive, the function of many families is to have and raise children. And then affective and coping, the family should provide emotional comfort to family members and help members establish their identity and maintain it in times of stress. Now, the last one is socialization. Through socialization, the family teaches, and this is huge, their beliefs, values, attitudes, and coping mechanisms. They provide feedback and they guide problem solving. So if you look at all the things that the ideal family transmits to each other and into the next generation, you can see how sometimes families don't function well, and now we have dysfunction. So there's a nice table in your book. I'm not going to tell you what page it is or what chapter it's in. You'll have to find the section on family and find the table that says family stages, tasks, health risk factors, and nursing interventions to promote health. And specifically look at the stage-specific nursing interventions or referrals and the risk factors column, because that gives you just a good example of where people are in life and what their risk factors are for that stage, and then what we can do if we see that they are exhibiting those risk factors. It's all good to know. Let's see what's on our next slide. Oh, that's what I'm referring to, that developmental stages and tasks. So find that table. And so lifestyle risk factors. It's also a box in your book in the chapter on foundations of thoughtful, person-centered nursing practice, health of the individual, family, community, and environment, find the box called Risk Factors for Altered Family Health. And specific to our older population, I don't know, there's not a ton, but maybe the lifestyle risk factors. Oh, environmental risk factors are good too. And really and truly think about our environmental risk factors. We have so many people talking about global warming. And if I asked you in class, not half, but a small portion of you would say global warming is just something that the media created. And I feel like that group of people is getting smaller and smaller as we see more and more evidence of how the health of our populations is being affected by the changes in our environment. Like look at how many more natural disasters we've had, more hurricanes, more fires. The fire seasons start earlier, they get bigger, they last longer. There's talk now about not having enough water to support our world population. We're already looking at what alternatives do we have to creating water so that we can sustain life. It is a little bit scary, I feel like. I've been talking 21 minutes. It feels like way longer. So that's just a few different examples. So let's go on. Community factors affecting health. This is another very big goal or area of concentration for our healthcare system in the United States and the world. We're looking at what defines a community and then how can the community affect people's health. And absolutely community does affect health because our communities offer access to healthcare services and they provide roads and schools and playgrounds and services and hopefully maintain a safe and healthy environment. Here's some other examples of community factors that affect health. You have what are the available healthcare institutions and services? Maybe you live in a rural area that you have to drive 4 hours away to get healthcare. I don't know of too many places where that's still a fact, but it is still a fact. And people that live in rural areas versus urban have unique challenges in getting the same health care that you would if you lived in a city. You have housing codes. So hopefully housing codes are being enforced because think about slumlords. They have plumbing doesn't work, or they have infestations of rats or insects that cause disease. Your police and fire departments are factors in community health. Nutritional services for low-income infants, zoning regulations that separate residential and industrial areas. So I think it's a pretty well-known fact that those that live in lower income areas tend to be near industrial areas and near the airports. And the air quality affects especially the children, but also your older adults that have respiratory issues, or it causes the respiratory issues. We have air and water pollution, food sanitation, health education services, employment, recreation opportunities, violent crime, and drug use. Those are all things in our communities that can affect health, either in a positive way or in a negative way. Probably already talked about these. Sure did. Sorry, I'm not very good at moving my slides forward while I'm talking because I'm just looking at the book and telling you what I think is important to know. So there's the last slide of this PowerPoint that talks about characteristics of community influences on the health of a member of the community. So communities can be a neighborhood in a city. It could be a whole small town, but it's usually people that have common values or goals. I'm trying to think. There's a great definition in the book that I just closed, but it doesn't matter. Here it is right here. What are the characteristics that influence the health? So transportation and communication, healthcare resources, values and beliefs. So think about if you lived in a commune and your commune was, I don't know, let's say they were vegetarian, so they ate healthy, pretty healthy, Maybe you're not getting enough protein, though. It depends on what kind of sources you're using. But your commune doesn't believe in having any contact with the outside world, including medical. So you're going to just use holistic measures of untrained professionals to heal your children and your population as a whole. And you're not going to get your immunizations for your kids. So look at that little community that I just made a drastic example of, and think about the different things that are going to be issues for that community and their health. Look at your community and say, where do they work? Do they work in a factory that's using chemicals that could cause long-term health issues? Do they work in coal mines? That's going to cause black lung disease, or they may have a industrial accident where people die in an explosion from a buildup of natural gas. So it just depends on where you're from and where your community is as to what types of health issues you're going to experience and what we need to do as nurses to educate our communities. Thanks for tuning in. I hope you enjoyed this session on families and communities and health. I'll be back pretty soon with another topic.